This product is used to cleanse the skin and treat conditions like dandruff and seborrheic dermatitis. It can also be used to treat certain bacterial skin infections. The active ingredient, sulfacetamide, is an antibiotic that works by stopping the growth of bacteria. It is best to use this cleanser as directed by your doctor, typically applied once or twice daily. Make sure to follow the instructions on the label and consult with your healthcare provider for the best timing to use this medication. This medication is meant to be applied directly to the skin. You should wash the affected area with this product as directed by your doctor, usually twice daily for 8 to 10 days. Make sure to wet the skin well and apply a generous amount to the affected areas. Gently massage the medication with your fingers into the affected area until a full lather appears. Afterward, rinse well with plain water and pat the area dry. It's important to avoid getting this medication in the eyes, nose, or mouth, or on the eyelids or lips. If it does come into contact with those areas, make sure to wash with plenty of water. The frequency of use for this medication is based on your medical condition and how you respond to treatment. In addition to using this medication, it's recommended to wash your hair normally with regular, non-medicated, shampoo at least once a week. Using this medication regularly will help you get the most benefit from it. Try to use it at the same times each day to help you remember. It's important not to use more of this medication, use it more often, or keep using it for longer than prescribed. Using too much could increase your risk of side effects and will not improve your skin any faster. If you experience excessive dryness, you may need to rinse the cleanser off sooner or use the product less often. Make sure to ask your doctor or pharmacist for more details. As your condition improves, your doctor may direct you to use this product less often to keep your condition under control, such as once or twice weekly or every other week. Be sure to inform your doctor if your condition does not improve or if it worsens. If you experience redness, stinging, or burning of the skin, make sure to inform your doctor or pharmacist right away. It's important to note that the benefits of using this medication outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, if you notice any joint pain, rash, unexplained fever, mouth sores, signs of infection, weakness, unusual bleeding, dark urine, or yellowing of the eyes or skin, contact your doctor immediately. Prolonged or repeated use of this medication may lead to a fungal skin infection, so be sure to use it only as prescribed. While serious allergic reactions are rare, seek medical help if you notice any rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not mentioned, it's essential to consult your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Ovace Plus Cleanser, Extended Release, make sure to let your doctor or pharmacist know if you are allergic to sulfacetamide or other sulfonamides, or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have broken, scraped, or injured skin in the affected area. It's important to note that this medication may make you more sensitive to the sun, so it's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you do get sunburned or have skin blisters or redness, be sure to tell your doctor right away. If you have any upcoming surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware that Ovace Plus Cleanser, Extended Release can interact with other medications, which may affect how they work or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's important to keep a record of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Ovace Plus Cleanser, Extended Release include products containing silver that are applied to the skin, such as silver sulfadiazine. Always consult with your healthcare provider before using any new products in combination with Ovace Plus Cleanser, Extended Release. If Ovace Plus Cleanser, Extended Release is swallowed, it may be harmful. If someone has overdosed and is experiencing serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include nausea, vomiting, and pink/red urine. This medication should not be shared with others. It's important to note that this product may cause temporary staining of clothing, but the stain can typically be removed with regular washing. If you happen to forget a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Do not take a double dose to make up for the missed one. When storing Ovace Plus Cleanser, Extended Release, make sure to keep it at room temperature. Different brands may have varying storage requirements, so be sure to check the package labeling or ask your pharmacist for specific instructions. Avoid freezing the medication, and be aware that it may darken slightly over time, but this does not affect its effectiveness or safety. Keep all medications out of reach of children and pets, and do not dispose of them by flushing them down the toilet or pouring them into a drain. When the product expires or is no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.